I'm Tanaz Karmani. I'm a rheumatologist at the University of California, Los Angeles, where I run our vasculitis program as well. So I'm going to give you an example of a patient registry and all of the exciting research that has come out of this registry. This is the vasculitis patient-powered research network with the emphasis on patient-powered. So the goals of the VPPRN, in summary, it's a unique way of conducting research studies in these rare diseases. We'll go over some of the issues with the conventional research studies and how the VPPRN and some of these registries can help us overcome some of the logistic issues and cost issues, etc. And the important part is it is patient-powered and also patient-partnered. So I'm part of the VPPRN, and we have numerous patient partners who are contributors. They are the ones who also help us decide what research questions are of interest, not just to physicians, but what matter most to patients as well. And the goal is to conduct high-quality studies to advance the research in vasculitis in a more feasible way. So some of the challenges we find, of course, are these are rare conditions, so it's difficult to get large groups of patients who can participate to study some of these diseases. Also, patients are spread out geographically, and you may not be near a vasculitis center or a center who's doing the study. So that can limit how many patients can participate as well. It can be challenging to get the health information from physicians over to researchers. Funding is always an issue. Some of these large clinical trials are very expensive, including all of the logistics that go into it. And oftentimes, the researchers are not talking to patients about what's important to study. So the VPPRN helps with some of these issues. So the first thing is it's an online registry. So we'll go over some of the examples of studies that we've done using this as well. You don't have to be near a center that's studying vasculitis to participate. We can involve our patients who can fill in information that we can use for research, and also they can help us decide what aspects of research to pursue. So here are some of the different types of studies that we can do. The first would be what we call observational studies. So here there's no treatment or anything being done. All we're doing is collecting data with standard forms and questionnaires that people fill about their symptoms, diagnosis, medications, etc. And we're just watching over time, and we can get a lot of information from just these observational studies. The next are survey studies, so where we ask participants who are interested to enroll in a study, and then there's a survey regarding information that the patients fill out. So an example is a survey that looked at outcomes in terms of work in patients with vasculitis, including after they were diagnosed with vasculitis, work limitations, whether they were still employed, etc. I'm going to go over the ANCA vasculitis-associated patient-reported outcome, which was also a type of survey study, which we'll talk about in more detail next. And then also looking at more novel ways to do some of the clinical trials and some of these studies looking at treatment. So not just observational studies, but are there more unique ways that are not as expensive as the conventional clinical trials, but just as safe in terms of investigating other approaches for our treatments as well.